Diabetes mellitus is a chronic multisystem disease characterized by hyperglycemia related to insulin production or abnormal insulin production and impaired insulin utilization, or both. 9.3% of the population have diabetes, and about 3 times as much have prediabetes. This is also the 7th leading cause of death in the US. Diabetes is the leading cause of adult blindness, end-stage renal or kidney disease, and non-traumatic lower limb amputations. It's also the major contributing factor to heart disease and strokes, seeing that more than half of the population with diabetes have hypertension and high cholesterol levels. There are 2 types of diabetes mellitus. Diabetes mellitus is characterized by either type 1 or type 2. Type 1 is usually seen in people under the age of 40. Usually they're born with it because it's a genetic trait, and we only see this in about 5 to 10% of the population that have diabetes. This is the way that the type 1 diabetes differs from the type 2 diabetes is that the body develops antibodies against insulin and the pancreatic B cells that produce the insulin. So that way your body cannot regulate those insulin levels. And the person can also not produce sufficient amounts of insulin to maintain a normal glucose level, and that is all type 1. Now moving on to type 2, which is mainly what I'll be talking about later on, this affects about 90 to 95% of the population that have diabetes, so it's a lot more. And the contributing factors that are associated with type 2 diabetes is overweight or obesity, being older, so greater than 40 years, although we are seeing it in younger kids, so people of all ages, just because of the unhealthy population that we are getting, and family history. So if your father or a parent have type 2 diabetes, you have a greater likelihood of getting it if you do not change your diet and exercise regimens. So type 2 diabetes is described by inadequate insulin secretion and insulin resistance. The major populations that have a greater likelihood of getting type 2 diabetes is African Americans, Asian Americans, Hispanics, Native Americans, Pacific Islanders, so people like from Hawaii. They're all at higher risk of developing type 2 diabetes than whites are. So some diagnostic studies that can show you if you have type 2 or type 1 diabetes is getting an A1C done. An A1C measures the amount of glucosidase hemoglobin as a percentage of the total hemoglobin. So for an example, if your A1C is 6.5%, that means that you have 6.5% of that total hemoglobin has glucose attached to it. So you want your A1C to be 6.5% or lower normally. So to measure your diabetes, usually a diabetic will have a 6.5% or higher for an A1C level. Another diagnostic study is by measuring your fasting plasma glucose. So your plasma fasting glucose level should be, if for being a diabetic, should be greater than or equal to 126 milligrams per DL. And fasting means that you're having no caloric intake, no calories at all, for at least 8 hours. There's also another test that you can do. It's called a 2-hour plasma glucose level. And then that should be greater than or equal to 200 milligrams per DL during an OGTT, using a glucose load of 75 grams. That test is usually not the first test. Your A1C is usually the first test that doctors will go to test for having diabetes. They'll also test this if you're on the level of pre-diabetic. That's how you can tell if you're leading toward that diabetes mark and you're getting out of that pre-diabetic stage. So some classic symptoms that you can look for to determine if you should be tested for diabetes or not. If you're urinating quite frequently, more than your usual amount, and then you're constantly thirsty, so you find yourself drinking more than usual, and you have an unexplained weight loss. Okay, so some management goals for managing your type 2 diabetes, or even type 1 at this point, but management goals can vary between nutrition, exercise, using prescribed medications, and then one of the major ones is monitoring your blood glucose levels. I will show you a video of how to monitor your blood glucose levels in just a little bit. But a diabetic or even pre-diabetes would want to keep their blood glucose as close to normal as possible, which requires daily decisions about what kind of food you're going to be intaking for the day, maybe counting your calories, blood glucose monitoring, which I talked about, and I will show you a video of how to do that, medications, and exercise. And really a key thing for those medications is following the doctor's prescribed dosages. So if you are on a calorie-based medication, you would want your calories to follow that medication, or you want your medication to be following those calories based on the doctor's prescribed scale that he gives you. There are different sliding scales for those medications, which I will get into when we talk about the insulin later on. Checking blood glucose after every meal and at bedtime is very important to manage your blood sugar. Or if you're getting insulin at different times, say you're getting insulin every 4 hours or you're getting insulin every 6 hours, monitor your blood sugar at those times, prescribed times. But the average amount of prescribed times is usually checking it after every meal to monitor really those calories, or right before every meal, sorry. So you want to check your blood sugar before the meal, and then count your calories, and then check it at bedtime to see if you need a snack or anything to get yourself through the night. So
show you how to monitor your blood sugar. The first thing you need to do is simply wash your hands. The reasons for washing your hands is so that they're clean and you'll get an accurate blood sugar reading. Then you'll need to get your meter out. I've already set my meter up with the date and the time, so it'll be ready to go. A couple of things I want to point out about your meter is that there's 800 numbers on the back of your meter. If you have any problems with your meter, simply call your 800 number on the back. This particular meter has 2 batteries on the back. If the batteries get low, it will give you an icon so that we can change the batteries. The next thing you will need is your strips. Strips are very sensitive to light, temperature, and moisture, so you need to keep them in the vial that they came with. The other thing I want to point out is the expiration date. It's very important that they're not outdated. Do not use strips that are outdated. You may not get good results. Next, you'll want to get out your lancet holder. This particular lancet holder comes with 2 different colored caps. The solid colored cap that I will be showing today is to be used on the sides of your fingers. The clear cap is to be used on sites when you're not using the sides of your fingers. Today, I'm going to use the side of my fingers, so I'm going to take this one away. The reason I'm using the sides of my fingers, it's the most accurate. And when you're using the sides, make sure you use either side, not the pad or the tip. Using the pad or the tip will hurt. The next thing I need is a lancet needle. I like to put my lancet needle directly into my lancet. It will only go so far down. Twist the top and take this off. Then go ahead and place the cap on. The cap has different size drops. Most lancet holders will either have dots or drops, or sometimes they're down here, or numbers. The larger the dot, number, or drop, the deeper that needle will go into your finger. So you want to turn this down to the lowest setting possible and still get a good drop of blood. Most lancet holders work on a spring, so I'm simply cocking this and it's going to be ready to use. The next thing I'm going to do is get my vial of strips, open it, closing it. These strips are very user-friendly, meaning I can touch them all over. The end with the lines is usually the end that will go into your meter. The side that has the little opening is where the blood will go. So pick up your meter, slide the strip in, and that will turn your meter on. Then you're simply going to wait until the meter prompts you, or follow the pictures. It's asking for a drop of blood. At this point, I'm going to take my lancet holder and I'm going to hold it against the side of my finger. If you don't see blood right away, simply milk your finger to get an adequate sample. Once you have a good sample of blood, simply touch the strip against, and it will draw it into the strip. And now I have about 5 seconds and it's going to give me a reading. And this is my blood sugar reading. Now you can get your record book out, and I would want to put my result in my record book. After that, I'm going to take my strip out of my meter, and you can simply throw this away. Now my lancet, I want to use my lancet one time. I'm going to take my lancet out and I'm going to place this into a sharps container. If you have any questions about monitoring your blood sugar, please talk to your healthcare provider. Thank you.
So another way besides the insulin that I had talked about, which I will talk about further later on, is nutrition. Nutrition is a major and important part of managing your diabetes without medications. So if you're a person that does not want to take medications, you really want to monitor your nutrition to lower those blood sugars and to really stay ahead of it. So you want to keep your cholesterol, like as I had talked about, people that have diabetes usually have a high cholesterol and high blood pressure. So you want to keep your cholesterol lower than 200 milligrams per day, and lower your trans fats. Your trans fats are what give you that high cholesterol. So you want to keep your LDLs low and your HDLs high. Your fiber should be kept between 20 to 30 milligrams per day. Or, not milligrams, grams. 25 to 30 grams per day. Healthy fats are those that I said you should go towards. Excuse me. That I said you should go towards. So, like, an example of healthy fats are those found in plants, so such as olives, nuts, and avocados. Those are the ones that you want to keep in your diet to really subside those LDLs and get your HDLs higher. Alcohol should also be kept to a limit. For women, usually you want to keep it to about 1 drink per day, and for men, about 2 drinks per day. The reason we want to limit the alcohol is because it inhibits the breakdown of glycogen into glucose by the liver, causing hypoglycemia, which is not good. You want your glucose levels to stay as normal as possible, or else you can go into hypoglycemia or hyperglycemia, which are both not good. Your carbohydrate One way to monitor your carbohydrates is by counting them. So carbohydrate counting is a meal planning technique used to keep track of your amount of calories that you take per meal and per day. So carbohydrates should be kept within a normal amount, which is depending based on your blood sugar levels, your blood glucose levels, age, weight, activity level, and your patient preference of based on like what you normally eat, and your prescribed medications. So the doctor, whoever is diagnosing you, will go through that with you and will probably prescribe you a dietitian to further go through that with you, because it is very hard to change your diet at any age and like differ from something that you're so used to. So another way, if you have a hard time with the nutrition, is to exercise. Exercise is very simple, and it should be kept to a daily amount of exercise. The ADA recommends that you exercise at least 150 minutes per week, which is about 30 minutes per day, 5 days a week, which is doable. And they recommend that you do like brisk walking, even fishing at some points in time is good. But for type 2 diabetes, they also recommend that you do resistance training at least 3 times per week. So that could like include like walking or biking or doing some lifting or something like that. Something along those lines that is increasing your heart rate just a little bit more. Exercise decreases insulin resistance and can cause direct effect on lowering blood glucose levels. And to have its best effect, you want to exercise directly after eating meals when your blood glucose levels are rising. With the medications to treat diabetes, there are 3 major types of glucose. We have the lowering agents, such as like insulin, oral agents, and then non-insulin injectable agents. The main ones that we use are, of course, insulin. So all individuals with type 1 require insulin, whether that is through a pump or injectable. They require a bunch of different amounts of insulin too. For some people with type 2 diabetes, they require more insulin than others, and others can manage their type 2 diabetes with just a healthy eating plan, like we discussed before, regular physical activity, and maintenance of a healthy body weight. But over time, if they're not careful, they may, and they're not like being effectively managing their blood sugar, they could over time require more and more insulin and be on a stricter regimen of insulin requirements due to the progressiveness of the diabetes. Insulin is injected when patients have an inadequate amount to digest or to perform daily activities. So insulin helps break down the sugars in your body as we're eating. So people who cannot meet the basic metabolic needs need just a little bit more insulin to help regulate their body, help move everything along. Type 1s need insulin to survive due to the inability to produce the insulin. So they require the injectable insulins. Most type 1 diabetics have an insulin pump that is attached to their stomach that regulates their blood sugar, and when it sees that a number is too low, it constantly is pumping in insulin into their body to help them perform daily activities. Type 2 diabetes, type 2 patients need insulin when they have a high stress environment or they're in a high stress event. such as being sick, ill, um, they're going into surgery, they might require a little bit more insulin just because their body needs that to function because you use more sugars when you're in a high stress environment. Um, Types of insulin are rapid acting, short acting, um, intermediate acting, and then long acting. And we also use combination therapies, which is combining a couple different types of insulin to help regulate a little bit better. The most common one that we see in type 2 diabetics is that rapid acting or short acting. Rapid is a little bit more beneficial to everybody's daily lifestyle, so that's typically used a little bit more than short. And intermediate and long is typically used more in alongside of the rapid and short with type 1 diabetics. So I'm going to insert a picture and you'll see, but rapid is used for something that takes about 30 or 10 to 30 minutes to digest, such as like if you're eating a meal, you would want to give yourself the rapid 15 minutes after eating your meal so it has time um, to work alongside that meal digesting. With short acting, you'd have to give it 30 to 45 minutes before that meal because it acts in about 30 to 60 minutes is its onset. So you want to give that before the meal, which is why it's not too effective or too lifestyle friendly to most people, which is why rapids use more often. Um, rapids onset is about 10 to 30 minutes, so that's why rapids used after the meals versus before the meals. Um, what's really important, so with the how I said before that intermediate and long are used alongside the rapid and short with type 1s, that's because um, they react over like 6 to 12 hours or over 24 hours. And with type 1 diabetics, they're not making any insulin. They need that background insulin to constantly go through their daily activities and daily lifestyle, whereas just the rapid and short are acting upon your meals and covering those extra calories that your body can't cover. So they do need that with their meals, but they also need the regular insulin that type 2 diabetics can produce and manage, and type 1s cannot. The key is to monitor your blood sugars and then inject the insulin therapy as needed. And your goal is to have a blood sugar of about 80 to 130 milligrams per DL before the meals. So keeping that between that average is where you're going to have the best results for diabetes, and keeping like going with the progressiveness of the disease. You'll keep your lifetime longer. You'll keep your insulin requirement shorter, and you'll be able to manage this disease a lot more effectively and have a lot less outcomes of kidney disease, amputations, other stuff that diabetes typically gives you. We have so type 1s, I said, use short for meals, but they also use long for overnight. So like they need something to cover between those meals and at bedtime because they could go into hypoglycemia or DKA, which is diabetic ketoacidosis, which is a very high likelihood with type 1 diabetics who cannot regulate their blood sugar as effectively due to no insulin production in their body. Insulin should be kept in dark and cool places. Insulin that is kept in heat or in sun or in the freezer goes bad and you cannot use it. So it's a good place is dark, cool places. Usually kept no more than 86 degrees Fahrenheit and no less than 32 degrees Fahrenheit. You want to keep it out of direct sunlight and keep it in the jars that it comes in, due to there's a coating around the jars that keeps the sunlight out. You want, if you're getting pre-filled syringes from your pharmacy, you want those pre-filled syringes to stay in the fridge. The mixed pre-filled syringes, such as I said before, the combined insulin, so 2 or more insulins in one syringe, can only last in the fridge for 1 week. And if you have a pre-filled syringe with just one insulin, it can last in the fridge for 30 days. And when you go to give that pre-filled syringe, you want to roll it between your hands 10 to 20 times before injecting it into yourself. And as I showed before in a previous video, or like the way you give insulin is you would grab your stomach. So you want to do it in your general area if you're doing long lasting, in your abdominal area. There's 4 quadrants. You want to do it in those lower quadrants. And then if you're doing the short acting, you're going to do it on the back of your arm, which you're going to like just pinch, and then you're going to inject into your side. Most of the time it's easier for people to inject in their stomach, which is why they'll go to their stomach if they cannot reach the back of their arm to inject themselves. But you're going to want to pinch and then inject and then push it in. Usually you do it to fatty areas. You can do it to your thighs. You can do it to your butt, your stomach. But as I said before, we like to keep the stomach to just the long lasting. And after you're done with the needle, you want to get a sharps bin. Throw the needle in the sharps bin just to keep it away from having a hazard accident, keep it away from children, and then you can empty those sharps bins in local sharps collection agencies, which you can find close to your neighborhoods. There's a couple, usually pharmacies will have some. And then you want to, when you're giving your insulin, you're following a sliding scale, which is different depending on each individual and how far your diabetes has gone. So based on what your doctor gives you, there's going to be a sliding scale, and you're checking your blood sugar with the sliding scale. And when your blood sugar is between a certain amount, say it's between 120 and 140, and that sliding scale, they could say, oh, you're going to give 1 unit of insulin. You're going to draw up that 1 unit and then inject yourself with that 1 unit. That's based on the sliding scale, so everyone's going to be different. I hope this helped you with your new diabetes. And if you are pre-diabetic, I hope this helps you to get your nutrition together and exercising and helping you stay under that pre-diabetic term and not become a diabetic. Thank you. Have a great day.